So hello and good afternoon. Am I audible, Satyam? Am I
Yes,
audible?
sir, you are audible. Yes, sir, you are
Okay.
audible.
Okay. Have you submitted your synopsis topic?
No, sir, I have got a little time more.
Okay. To think about more topics. Okay.
Yes,
What all topics
I
you
have
have
said,
thought?
sir, I have selected five topics. I will
Okay.
talk with my senior, immediate senior. Here
Okay.
exam is going on, na,
Okay.
for the
Okay.
21st batch,
Your
basically.
immediate senior exams are going on.
Yes, sir, from today.
Okay. Okay. So can we begin now?
Yes, sir,
Can you
you can
start our
begin.
course? Okay. Uh,
Okay.
we have completed in last class Tolecosm. Okay, the three chapters in the Tolecosm, which consist altogether 25 paragraphs. So we have completed those first chapter of Tolecosm. In the last class, in hurried, we have discussed the concept of mechanical cause. Okay, I hope you people got that. I discussed a case of too much worm in the intestine, which was causing a bladder irritation and causing a nocturnal enuresis in a grown-up person, which failed me with symptomatic treatment until and unless I decided to use teucrium as vermifuge, and after that the patient started to respond to our medicine. Okay, any question to that section, that part? Do you people have any question to that part? I have shared an article also to get it understood more, means get it very clear that sometimes some symptoms are mechanical. Okay, sometimes some symptoms are mechanical, and that not necessarily means a foreign body in the eyes or foreign body in the body cavity, but sometimes like head of the pancreas causing obstructive jaundice. This obstructive jaundice is a cancer head of the pancreas, is the mechanical symptom of due to obstruction by cancer head of pancreas. Okay, so these mechanical symptoms will not respond, and that is the dex preposition where the cause which is causing the symptom still persists. Our medicine will not work. You have to take care of that cause. In that sense, we have discussed. Okay, so let us start today from 25 number paragraph, which is again next three sections are of this next three sections, three chapters actually are from derivatives. Okay, we have divided introduction in sections, is it not? In content we have altogether Tolecosm consists of three chapters. Then derivative methods. Derivative methods is it consists of three chapters. Okay. In it you will get the concept of deus natura in this section. The concept of deus natura, minister naturae. Okay. Let us begin from paragraph number 25. Please someone volunteer yourself to study, to read it. Someone please volunteer yourself to read. So Satyam, you are only one left. Please start. Please start.
Sir, introduction, 25th para.
25th para. Have you numbered your paragraph?
But yes, sir. But the more, or hence.
Yes.
But the more, no?
Yes, but the more.
But the more modern adherents of the old school do not wish it to be supposed that in their treatment they aim at the expulsion of material morbific substances. They allege that their multifarious evacuant processes are a mode of treatment by derivation wherein they follow the example of nature, which in her efforts to assist the diseased organism resolves
Underline
fever.
derivation. Underline derivation. What is going on? These are the methods used during time of Hahnemann, that what nature is trying to do with the sick person, we will just enhance that. So examples follows. These are the examples. Nature allays the fever by perspiration. Start.
In the following which resolves fever by perspiration and diuresis, pleurisy by epistaxis, sweat and mucus expectoration, other diseases by vomiting, diarrhea and bleeding from the anus, articular pains by suppurating tonsillaris, tonsillaris by salivation, and etc., or removes them by metastasis and abscesses which she develops in parts at a distance from the seat of the disease.
Okay, this is the basic philosophy behind this philosophy behind this derivative methods. Okay, next three chapters in the introduction is dealing with the derivative methods. Okay, next chapter. Next paragraph.
Hence, they thought the best thing to do was to imitate nature, that is to copy nature, na?
Yes.
By also going to work in the treatment of most diseases in a circuitous manner,
Hmm.
like the diseased vital force when left to itself, and thus in an indirect manner. If
Hmm.
yeah, one footnote.
Okay. There is a footnote. We will discuss that
Yes,
later.
sir.
Read on.
Okay, sir. By means of stronger heterogeneous irritants applied to organs remote from the seat of disease and totally dissimilar to the affected tissues. They produce evacuations and generally kept them up in order to draw, as it were, the disease theater.
Disease itself. Okay. Next.
So disease THITHER.
Disease itself. Theater.
Okay.
That is
Yes,
the,
sir.
they are thinking that these are the disease itself. Okay.
Okay.
Disease
Okay,
itself
sir.
and trying to remove them.
Okay.
And next para is the
This
definition
yes,
of, next para is the derivation definition. Definition of
yes.
derivation.
This derivation, as it is called, was and continues to be one of the principal modes of treatment of the old school of medicine.
Okay. Next. Sorry, it was not
Yes,
a definition of
yes, sir.
derivation. Next.
Next, in this imitation of the self-adding operation of nature, as some call it, they endeavor to excite by force new symptoms in the tissues that are least diseased and best able to bear the medicinal disease, which should draw away, footnote 2, the
Hmm.
primary disease under the semblance of crisis and under the form of excretions in order to admit of a gradual lysis by the curative powers of nature.
Now read the footnote number 3.
Footnote 3. It is only the slighter and acute diseases that tend, when the natural period of their course has expired, to terminate quietly in resolution, as it is called, with or without the employment of not very aggressive allopathic remedies. The vital force, having regained its powers, then gradually substitutes the normal condition for the derangement of the health that has now ceased to exist. But in severe acute and in chronic disease, which constitute which constitute
By far the greater
by
portion of
far
all
by
human
far
beings.
the greater portion of all human elements, crude nature and the old school are equally powerless. In these, neither the vital force with its self-adding faculty nor allopathy in imitation of it can effect a lysis, but at the most a mere temporary truce, during which the enemy fortifies himself in order sooner or later to recommence the attack with still greater violence.
Okay. What is there? One thing mainly you should draw from this footnote, that in cases of acute diseases which are not of severe nature, these sort of treatment sometimes helps. Okay. You gave in case it was a acute disease, you gave some painkiller and the patient got relief for the time being for of that pain, and the acute disease was of shorter duration. Okay, in a short duration, so it goes by itself. Okay, but in cases of acute diseases which are of very severe nature and in chronic diseases, neither the vital force has not been there to help the organism to cure. Okay, without any outside help. Role of the vital force is very clear, that it is maintaining the harmony in healthy condition. Okay, in disease condition, this vital force need outside help. Okay, in disease condition, this vital force needs outside helps. That is why it is again and again producing symptoms for the physician. In spite of giving your attention to those symptoms, if you are following to enhancing those symptoms, okay, फीवर को एले करने के लिए वाइटल फोर्स समटाइम्स causes perspiration and you are giving medicines which is causing more perspiration, it is not going to help the vital force. Okay, next para. Next para.
29.
28 I think. Oh no, 29. Yes, 29.
This. Yes. This they accomplished by means of diaphoretic and diuretic remedies.
What is diaphoretic?
Which increase perspiration, Juliet.
Which increase, which causes sweating, perspiration.
Yes.
Okay.
This they accomplished by means of diaphoretics and diuretics remedies.
Diuretic is producing urine, है ना?
Urine, yes sir.
Okay.
Bloodletting, cetones and issues.
What is cetones and issues? What is cetones and issues?
Sir, I don't know, sir, cetones.
Issues?
Issues means delivery.
No, not delivery. Both are the same thing. Said it is nowadays used in Panchkarma therapy of Ayurveda. It is not used in modern medicine. Okay, it is of older days medicine where people used to produce ulcer on the surface in order to allay some internal disease by the method of thread passing on the surface skin. Okay, that is called seton or issues, and it is maintaining an external ulcer by means of which these internal diseases were being remained calm. You will get an example of this in aphorism number, let me tell you, where Hahnemann is discussing about this similar diseases. Yes, that thing. That is in aphorism number, I think it is 39. Aphorism number 39. Aphorism number 39. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. नीचे से 10th line. From below 10th line, you will get epilepsy.
Yes, sir, epilepsy, sir. Suppressed for many years.
Many years of use by issues invariably recurred. Suppressed by issues. That is the issues or thread passed by external surface, so that what it is doing actually, it is producing an artificial disease which is stronger than the natural disease and suppressing the natural disease. Okay, nowadays it is not being used, only used in Panchkarma or like that therapy in Ayurveda, okay, or Unani medicines. It is not being used in modern medicine. Okay, now what Hahnemann have done, Hahnemann have done a critical analysis of the method of treatment of his time. Okay, and what we should do, we should analyze the method of modern school treatment of our time. What are controversials, what are not to be used, when not to be used, why they are using as routine. Okay, again and again I am sharing some cases where they are following the routinism, prescribing antioxidant, prescribing vitamin D. Of vitamin D toxicities are there irrespective of bad effect of vitamin extra antioxidant in the body. They are following these methods. So we have to open our eyes and be clear and know something about the allopathic pharmacology. Okay, allopathic pharmacology, knowing allopathic pharmacology is essential, not for doing bridge course that we will also prescribe allopathic medicine, but it is important to know what sort of medicines they are giving in order to help your patient to understand and to prevent your patient from the danger ahead. Okay, every now and then you will see statin is prescribed for this lipid profile. A bit lipid profile is up and down, they will start statin, and that is going to cause this hyperglycemia. Okay, they will give HRT to the menopausal woman. Even if the woman is complaining of some joint pain for 2-3 days, they will start HRT, irrespective of any danger of this hormone replacement therapy, because they know that we know that after menopause this estrogen is becoming less and less and causing osteoporosis, but 2-3 days pain is not needed to be followed by HRT, hormone replacement therapy, and the patient is on and on for 3 and 4 months, and this is causing an artificial disease, hormonal disease, masked hormonal disease. So this is the importance of reading introduction, so that we can be aware of the treatment of our time. Okay, these satans and issues are not being used, but it is being used in Ayurvedic Panchkarma therapy. Okay, these are being used there. So we can prevent our patient by telling them this and that thing may happen to you. Next.
Yes, sir. But chiefly by irritant drugs to cause evacuation of the alimentary canal, sometimes upward by means of emetics, sometimes downwards by means of purgatives, which were termed aperient and dissolvent remedies.
What is aperient and dissolvent? These are mild laxative. Mild laxative.
Mild. Okay.
Okay, these Kaim Churan, Pet Tafa, these are nothing
Yes.
but laxatives. Okay, people are using
Yes.
randomly without any without thinking. They are claiming that they have no side effect, but it has side effects in the long term. Okay, next.
Yes.
Next, paragraph number 30.
Yes, sir. To assist this derivative method, they employed the allied treatment by counter irritants, woolen garments to the bare skin, foot baths, nauseants, inflicting on the stomach and bowels the pangs of hunger. The hunger treatment, pangs of hunger means substance to cause pain, inflammation, and suppuration in near or distant parts, as the application of horseradish, mustard plasters, cantharides, blisters, mesarium, setons, issues, tartar emetic ointment, moxa, actual cautery, acupuncture, and etc. Here also following the examples of a crude, unsatisfied nature which endeavors to free herself from the dynamic disease by exciting pain in distant parts of the body, by metastasis and abscesses, by eruptions and suppurating ulcers.
Okay, this is the method of nature, unassisted nature, not unsatisfied, unassisted nature's method to produce, like sora is infecting the body. What nature will do? Nature will try to expel the disease to a distant part, okay, to skin. Sora, after development in whole body, there is a moment of infection and the whole body is infected. Now the vital force will try to compromise with the disease and try to locate the disease in the most distant part and the most harmless part. That is the skin, and that is the skin manifestation is there. And they are thinking if we will be able to produce some skin manifestation, internal disease will be calm. They are following this. This is derivative method. Now, let me know your thoughts about acupuncture. Hahnemann have put acupuncture in this derivative method only. What you think about this acupuncture? This may be your interview question, maybe your medical officer in going for an interview in a medical officer post. A good examiner may ask your thoughts about acupuncture, whether it is allowed in homeopathy or not.
I don't think so, sir.
What do you think? Will you put it in auxiliary methods of treatment, where Hahnemann have advised
Yes,
about
sir.
this mesmerism, where Hahnemann have about massage, bathing, electricity, galvanism. You will put this in auxiliary methods of treatment, or acupuncture is altogether forbidden. Hahnemann is putting acupuncture here where he is criticizing the old school. What is your stance? This may be your question in your examination, means interviews.
Sir,
Acupuncture is allowed or not?
no, sir, it is. It will be not preferable.
It will not be preferable.
Perhaps.
Anyone? 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 Now you have to be very technical with this, that this
Yes.
acupuncture have been propagated by many of our stalwarts. Okay, but it is
Like,
altogether sometimes not needed. During Hahnemann's time, the needles which were used during Hahnemann time, if you see the history of acupuncture, you will get that those needles were pretty harmful. Means nowadays the needles being used, or they are not altogether using needles, but using the thumb pressure to particular parts of body. There is no harm in using that. If you are using needles for acupuncture, that should not be allowed, but you are using your thumb pressure, that may be allowed. That many of our stalwarts of recent date were very good acupuncturists, okay, and using
okay.
homeopathy side by side. But acupuncture in the crude sense of Hahnemann's time is not allowed. But nowadays it has become a sophisticated art, so it can be used. You should be
Okay.
very much means diplomatic about it. No direct
Okay.
yes, no direct no. Okay,
Okay.
in your interview examination, interviews, particularly these questions are asked in medical officers interviews, that like UPSC or like some lecturer post you are going, they will ask you this. So number this and now number 31, paragraph number 31.
Yes. It was evidently no rational principle, but merely imitation, with the view of making practice easy, that seduced the old school into those unhelpful and injurious indirect modes of treatment, the derivative as well as the counter irritant that led them to this inefficacious, debilitating and hurtful practice of apparently ameliorating disease for a short time, or removing them in such a manner that another and a worse disease was roused up to occupy the place of the first. Such a destructive plan cannot certainly be termed curing.
Next, this is
Next,
just means over criticizing something. Hahnemann is
yes,
was a prophylactic writer. What he can say in 2 or 3 words, he will say in 10 or even a paragraph. Okay, so this is
yes.
again a repetition of what already have been said.
Okay. They merely followed the example of crude instinctive nature in her efforts, which are barely successful even in the slighter cases of acute disease. They merely imitated the unreasoning life preserving power when left to itself in diseases, which entirely
Okay,
dependent as
and
it is.
these are the characteristics of vital force. What are the characteristics of vital force? It is dynamic, present everywhere
Yes,
in the body. Okay, another
yes,
characteristic is unreasoning. It has no
yes,
reason. Okay,
yes,
like if
yes,
there is a small boil here, if it is not healing, it will produce a gangrene there in the finger and try to dislodge this finger from the body. Anyhow, he have to save the life at any cost. It is reasonable for a boil sacrificing a finger. No, but
yes.
vital force is unreasoning. When left alone, it will organism of his eyes, because he have to trying to vital force is trying to save the person any cost. Life should go on. Okay, this is unreasoned vital force. Okay, dynamic,
Yes.
unreasoned, self-preserving, always
Yes.
try to life preserving, always try to preserve the life at any cost. भले ही हाथ चला जाए, पैर चला जाए, आंख चला जाए, उसको उससे कोई मतलब नहीं. It will try to preserve life at any cost.
Life.
So unreasoning, illogical. Okay,
Yes. Yes,
these
sir.
are the characteristics of vital force. These are the characteristics of vital force. Next.
Which entirely dependent as it is upon the organic laws of the body, is only capable of acting in conformity with these laws, and is not guided by reason and reflection. They
Underline this.
copied nature.
Vital force not guided by reason and reflection. Now
They
you are
copied.
copying this, and you are copying this vital force. You are trying to copy this vital force. Even these efforts are of vital force are helpful in acute disease of mild character only, not of severe character, not of chronic disease. These are not worth copying. Try to prevent that destruction. There are two things: lysis and crisis. Okay, don't go for crisis. Go for lysis.
They copied nature, which cannot, like an intelligent surgeon, bring together the gaping lips of a wound, and by their union effect a cure, which knows not how to strengthen, straighten, and adjust the broken ends of a bone lying far apart and exuding much new osseous matter, which cannot put a ligature on a wounded artery, but in its energy causes the patient to bleed to death, which does not understand how to replace a dislocated shoulder, but by the swelling it occasions round about it soon presents an obstacle to reduction, which, in order to remove a foreign body from the cornea, destroys the whole eye by suppuration, which, with all its efforts, can only liberate a strangulated hernia by gangrene of the bowel and death, and which, by the metaschematism it produces in dynamic diseases, often renders them much worse than they were originally. But more, this irrational vital force receives into our body without hesitation the greatest plague of our terrestrial existence, the spark that kindles the countless diseases beneath which tortured mankind has groaned for hundreds and thousands of years. The chronic miasms, sora, syphilis, and psychosis, not one of which can it diminish in the slightest degree, far less expel single-handed from the organism. On the
Okay,
contrary,
stop
it
here.
allows.
Underline
Yes, sir.
this. Stop here and underline this. Irrational vital force receive into our body without hesitation
Yes.
the greatest plague of our terrestrial existence, and leave these sentences. These are the literature, the language. You can appreciate the language but cannot understand if you are reading this. Now read directly.
Yes.
Chronic miasms. Chronic
Yes.
miasms.
Chronic
Now,
miasms, sora, syphilis,
no.
psychosis. Oh, wow.
Underline this. Underline this.
Yes.
Up to organism. Up to organism. Now I am reading this and try to understand. Irrational vital force receive into our body without hesitation the greatest plague of our terrestrial existence, the chronic miasm. This is the greatest plague of our terrestrial existence. Sora, syphilis, and
Existence.
psychosis. Okay. Next. Acha, there is a longer footnote here to the paragraph number 32. Okay, try to read this. We will underline some important line here. This is a good footnote regarding vital force. Okay, regarding vital force, we have discussed that vital force have got no place in the previous editions of Organon of Medicine, but Hahnemann was believing that it is the medicine which is only going to help the body to cure itself, but the vital force got its role in the from the 5th editions onward. even in the 6th edition, vital force had got a major role to play in the health, as in the disease also, assisted by the external medicines. Okay, so this is important. This footnote is important to understand the philosophy of vital force. Okay, we will underline and discuss it again somewhere when we will read vital force. We have discussed some point at some point of time in previous classes what role vital force is playing in disease, okay, and what role it is playing in health. Now read this footnote also.
In the ordinary school of medicine, sir.
Yes.
In the ordinary school of medicine, the efforts made by nature for the relief of the organism in diseases where no medicine was given were regarded as models of treatment worthy of imitation. But this was a great error. The pitiable and highly imperfect efforts of the vital force to relieve itself in acute diseases is a spectacle that should excite or compassion and command the aid of all the powers of our rational mind to terminate the self-inflicted torture by real cure. If nature is unable to cure homeopathically a disease already existing in the organism by the production of another fresh malady similar to it, referring aphorism 43 to 46, which which very rarely lies
Really
in her
lies in
power.
power. Now it is
Yes, sir.
referring to that aphorism where that nature is being cured by similar disease, and that is not in his power. That is happy-go-lucky nature of cure of nature. That smallpox was curing atrophy of testis. Okay, these
Yes,
sort of examples
yes,
are given there, that some natural disease comes which was similar to the already affecting disease and it was cured. So nature cannot bring similar disease. This is the ideal cure, where similar disease is curing the disease already there in the body. But this is not happening in every case, because it is not in power, in nature's power, to attract the similar disease always. Okay, this
yes,
is the thing.
yes.
Next.
And if it to the organism alone is left the task of overcoming by its own forces and without external aid a disease newly contracted, we then witness not but painful, often dangerous efforts of nature to save the individual at whatever cost, which often terminate in extinction of the earthly existence in death.
Okay, comma in this
Lit
earthly existence नहीं किया था तो भी चलता. Okay,
yes,
but this is
yes,
the mode of language of Organon which is making it difficult to read. Okay, that is why we
yes,
are following this. Okay, next.
yes, yes. Little as we mortals know of the operation that take place in the interior economy in health, which must be hidden from us as certainly as they are patent to the eye of the all-seeing creators and preserver of his creatures.
Mark, the creator is capital C, preserver is
Yes, sir.
capital P.
Capital.
Okay, that what that means? That means he is referring to God. Okay, it is a noun and he
Yes.
is referring to God. Only God can see, Almighty God can see what is going internally. Pathophysiology is only clear to him, not to you. You cannot say that this disease is being produced in this manner. Okay.
Mm. Just as little can we perceive the operations that go on in the interior in disturbed condition of life in diseases. The internal operations in diseases are manifested only by the visible changes, the sufferings and the symptoms, whereby
Underline this.
alone our
Underline this. Internal operations in disease are manifested only by the visible changes, the sufferings and the symptoms. Okay. If there is no symptoms, you cannot promise a cure. Aphorism number 14, content. Read aphorism content. Go to content
Aphorism 14.
of aphorism number 14. Aphorism number 14. Content.
Yes.
Read what is there, written there.
Everything.
Ah,
Everything of a morbid nature that is curable makes itself known to the physician by disease symptoms.
okay. If it is not
Yes.
curable, how to understand the case in hand is not curable? Because it is not giving symptoms. Okay.
Yes.
Only thing you are perceiving as an unprejudiced observer is the symptoms. It's not the pathophysiology. And it's not your duty to find out what pathophysiology is behind a particular symptoms. It is the duty of pathologist. If you are a physician, act as a physician, not as a pathologist. Okay. So the internal disturbance is shown up by the symptoms and the sufferings only. Okay.
Yes.
Next.
Whereby alone out of life we trace the inward disturbances, so that in no given case can we ascertain which of the morbid symptoms are caused by the primary action of the morbific agent, which by the reaction of the vital force for its own relief. Both
Okay.
are
So we cannot locate the pathophysiology of a symptoms.
Yes.
Of a symptom. We cannot locate pathophysiology of a symptom by telling that. So it was of during Hahnemann's time. Okay, it was during Hahnemann's time that pathology was not that advanced. Okay, but now we can trace to some symptoms. We can trace back the pathology. We have discussed nomina and phenomena. Is there in your mind nomina and phenomena? What is phenomena? What is nomina? Anyone? We have discussed though this phenomena and nomina. Hughes concept. The phenomena is outwardly reflected picture and nomina is inside the pathology behind that. Okay. If the patient is telling that on examination you can see or patient is catching the breath, you are pressing the gallbladder position in the right hypochondrium and patient is catching the breath. Okay, this is a particular sign indicating of gallbladder inflammation, cholecystitis. Okay, so you are seeing the phenomena outside and the nomina inside. Often you can correlate this phenomena with the nomina. Stitching pain on inspiration. There is a pleuritic adherence due to pleurisy, and you will prescribe your brainia with confidence because you know that here is a nomina and here is a phenomena, both is corresponding to your brainia. Even if you are not finding nomina, you can prescribe on phenomena also. Okay, but knowing both is giving you confidence. Okay, like we have discussed a case of tucrium, cancer of the head of the humerus. One of our teacher, one of our stalwarts in Bengal prescribed tucrium, basing on solely on the nomina because there were not much features, symptoms were not there. So sometimes we can prescribe on the basis of pathology. Okay, sometimes during Hahnemann's time pathology was not that advanced, so he told that if there is no symptoms we cannot cure. If there is no phenomena, are you getting me? Are you getting me? Any problem you are
Yes.
facing in understanding this portion, what I am discussing? I have discussed this a lot before and I am discussing it again. That importance of pathology in prescription, in homeopathic prescription. During Hahnemann's time, Hahnemann have ignored pathology totally because the pathology was not that advanced. But now there are sophisticated instruments by that we can know whether the ulcer is round in the stomach. Round ulcer in the stomach, we have a medicine. Is it not?
Yes. Yes, sir.
Calibichrome.
Calibichrome. Yes.
Okay. So we can prescribe on the pathology also. But our main motive of prescription is, our main agenda of prescription is symptoms. Okay, what is externally manifested. But if the vitality is so low, only noumena is there, no phenomena, again you have to prescribe over that. Okay, that is where the pathology is coming to you for help. You are prescribing on the symptoms of spleen only. Vitality is so low that it is not producing the symptoms. Okay, so you can prescribe
Yes.
on the basis organ remedies, on the basis of organ affected. Okay, so this is the advancement of homeopathy, where you can use the pathology only. You are using pathology number one. Try to understand this very clearly. You are using pathology number one for getting confidence over your prescription. Chest pain aggravated by inspiration, you are thinking of pleuritic affection, prescribing your brainia. You know that brainia is producing pleuritic affection and serous affection. Pathology of brainia, Allen's में लिखा हुआ है, the affection of serous membrane. Okay, affection of serous membrane. You are thinking of pleura and thinking of this aggravation, getting this symptom, prescribing brainia. You are getting confidence here. Number 2 point, where there is no phenomena, no external symptoms are there, only by reports. By reports you are getting the pathology. Again, you are prescribing. 200 years ago, you cannot prescribe because you are not getting those pathology. Okay, those pathologies were isse ho gaya, usse ho gaya, not confirmed. But nowadays, pathology is confirmed by these sophisticated tests. CT scan of whole abdomen is revealing that there is mesenteric lymph node enlargement in the abdomen, and we know that these mesenteric lymph node enlargement has got affection for thyroidinum. Thyroidinum is a medicine got affection for enlarged mesenteric lymph nodes. Okay, so before it was not clear, the symptoms were not there. You cannot prescribe because there were no symptoms. But now you are getting by CT scan or by sometimes by USG also, it is revealed that there is mesenteric lymph node enlargement. There is a cortical cyst in the kidney and no symptoms. In the kidney there is a cyst, in the liver there is a cyst and no symptom. You can accordingly you can prescribe on these pathology because there is no symptom. You cannot term the disease is incurable. Disease is difficult to cure because the vitality is so low that it is not giving external symptoms. Okay, this is where the pathology is coming to our help. Clear?
Yes.
Clear? We have discussed this point again and again so that it is very clear where the scope of homeopathy can be enhanced. Okay, there are so many medicines which are particularly affecting these. We have discussed that affections of knuckle. Even Boning Hussain have told this affection of knuckle is very peculiar with the sepia. Okay, so no other symptoms are there. Affections of knuckle, you can prescribe on the basis of pathology here. Okay, but here is you are getting symptom, at least this is a kind of symptoms. I'm just giving an example. Next.
Both are inextricably mixed up together before our eyes and only present to us an outwardly reflected picture of the entire internal malady. For the fruitless effort of unsatisfied vitality to terminate the sufferings are themselves suffering of the whole organism. Hence, even in those evacuations termed crises, which nature generally produces at the termination of disease, which run a rapid course, there is frequently more of sufferings than of efficacious relief.
Next.
What the vital force does in these so-called crises and how it does it remains a mystery to us. Like all the internal operations of the organic vital economy. One thing, however, is certain that in all these efforts, more or less of the affected parts are sacrificed and destroyed in order to save the rest.
Okay.
These self, yes, sir.
Okay. Next, please.
Okay, okay, sir. These self-aiding operations of the vital force for the removal of an acute disease performed only in obedience to the laws of organic life and not guided by the reflection of an intellect are mostly but a species of allopathy. In
Underline this.
order to
Vital
really,
force.
yes,
Underline this. A species
yes, sir.
of allopathy. Vital force is termed here as a species of allopathy, trying to save the organism anyhow by sacrificing his energy, by destroying his parts.
In order to relieve the primarily affected organ by a crisis, an increased, often violent activity is excited in the excretory organs to draw away the disease from the former to the latter. There ensue vomitings, purgings, diuresis, diaphoresis, abscesses, and etc. in order by this irritation of distant parts to effect a sort of derivation from the primarily diseased part, and the dynamically affected nervous power seems to unload itself in the material product.
Next.
It is only yes, sir, it is only by the destruction and sacrifice of a portion of the organism itself that unaided nature can save the patient in acute diseases. And if death do not ensue, restore, though only slowly and imperfectly, the harmony of life to health.
Next.
Life health. The great weakness of the parts which had been exposed to the disease, and even of the whole body, the emaciation and etc., remaining after spontaneous cures, are convincing proofs of this. In short, the whole operation of the self-aiding power of the organism when attacked by disease displays to the observer nothing but suffering, nothing that he could or ought to imitate if he wishes to cure disease in a in a truly artistic manner.
Okay, underline this. What the this paragraph, what a vital force does is so-called crisis, and how it does it remain mystery to us, like all the internal operation of the organic vital economy. Underline this. This is what vital force, how vital force is producing symptoms. It is not clear and should remain a mystery to us, and we should not. A species of allopathy. Now, last three paragraphs is dealing with acute disease. What vital force is doing in acute diseases. We told that vital force can cure acute disease, okay, but in acute disease, why vital force is able to cure or able to allay? Because acute disease itself is of short duration, okay, and in that also, whatever the vital force is giving relief to the patient is by sacrificing a lot of energy, okay, a lot of
Yes.
destruction is there in the economy. That is why there is a weakness remaining after so and so acute disease, okay, and that too if acute miasm. Acute diseases are of three kinds we have discussed. That individual acute disease, which is explosion of latent sora,
Latent
is it
sora.
not? Okay, and
Yes.
we have discussed that there is a sporadic and there is epidemic diseases. For practical understanding, we have combined sporadic and epidemic diseases. Now, epidemic diseases can be of new kind every year, or can be of particular kind due to some acute miasms, and which are fixed in nature. Okay, that is called fixed miasm. Fixed miasm producing fixed symptoms. Okay, clear? So these sort of
Yes, sir.
acute diseases are also there. If acute disease of not of very severe character, the latent sora which was excited now came back to its normal, and the organism will go on for its healthy life. Okay, if that acute disease is not of severe character, but if it was of severe character, the explosion of latent sora will be there, and the genie is out of bottle, and there will be so many disturbance in the health. Number one. Number two, if that acute disease happens to be of acute miasm, it will leave some stamp on the organism. Okay, and that is we are calling acute miasm, causing some dent, okay, causing some stamp on the organism. Okay, never well since that parotid affection, mumps affection, never well since that measles. Okay, one of my case was of after measles. What is the complication? Late complication of measles. One of the late neurological complication of measles. Anyone? Late neurological complication of measles. I'm also forgetting that. That is sclerosing panencephalitis. Okay, I got a patient after measles. That patient was suffering from these sort of neurological disorders. Okay, and we prescribed in NIHOPD during my internship. Okay, that Malik sir diagnosed that case as this. Okay, and we prescribed morbillinum 0/1. Started with morbillinum 0/1. Okay, that acute diseases, acute miasm, measles, so severe that it produces that kind of complication. In these cases where there you are getting a history of acute miasm, you should not hesitate to prescribe the nosode for that miasm. Okay, acute diseases are doing two things. If it is of individual nature, it will excite the sora. You don't know the sora is upcoming. You will get cases of hair fall after so and so acute disease. Okay, any medicine you know, as we are discussing from the practical part, clinical part, we will, as and when we will get some clinical tips, we will give you. Any medicine you know, hair fall after acute disease? Anyone? Have you got Khatak's repertory with you? Khatak's repertory with you? Anyone
App.
having Khatak's? Huh?
Yes, sir. Application में है app. Photography
Yes.
पे app.
Yes. Try to find out. Not application. Try to get the physical books. Okay. Try to get the physical books. It is one of the hurdles we are facing to understand homeopathic philosophy. If you will go to hair affections, rubric hair affection. Got that?
Sir, if I will
You will
go
go
back,
to-
sir, then
Oh,
I will be out.
okay. Then you will stop being in class. Okay. Leave that. That is the teachment's application policy, that it don't let the this application run in the background. Okay. This is one of the things students are complaining about, but I think it is a good thing, because you put the lecture on and you go on surfing for something else. So main focus will be there in the class. That is the teachment's policy. So leave it. So Phatak's repertory, you will go hair affections falling after fever. Okay, falling after acute disease, you will get rubrics. And one of the medicine is fluoric acid. Okay, though fluoric acid is anti-syphilitic medicine, it is helpful here. So sora after sora, one of the symptom of sora is falling of hair, dry lusterless hair falling after acute disease. If you are getting falling of hair, you can prescribe this fluoric acid. Okay. After grief, one of the exciting cause for the sora is grief. Okay, you will get in chronic disease, Hahnemann's chronic disease, that one of the exciting cause for sora is grief. After grief, if you are getting, you will get this rubric in Phatak's repertory. After grief, if you are getting hair fall, you will got your medicine in phosphoric acid. Okay, acid phos. And I can swear by this rubric, I have got this result in my clinical practice that after grief, if there is falling of hair, what grief have done? Grief have excited the latent sora. What that acute disease have done? Acute disease have excited the latent sora. Accordingly, you have to prescribe medicine. But if acute miasm have done some dent to the organism, this is very easy. Go for the nosode of that acute miasm. Okay, and this thing should be kept in this class only. This is not for your viva purpose. Okay, if you are going to narrate these things to the orthodox viva examination, to all respect to our Organon teachers, I am also an Organon teacher. To all respect to them, you should keep these things up to this class and for your practical and clinical understanding. You should not hesitate to prescribe the nosode for that acute miasm. Okay, this is after that acute miasm. If this is happening, we have seen the effect of morbillinum, effect of parotidinum, effect of that variolinum in our day-to-day clinical practice. Okay, so this acute miasm and acute disease and the prescriptions of it. Okay, clear what these acute diseases are doing with the organism? We have cleared, and how to help the organism out of getting out of that destruction or out of that debility. Okay, we have finished up to this. I think 32 paragraph and its footnote, detailed footnote. We will deal it from tomorrow onward. Paragraph number 33. Any questions regarding today's class or any class you are having, you can ask so that we can follow up in next 5 minutes. Any portion you have not understand? Anyone? Okay. One thing you should should be in your mind that whenever you are asked in viva what is the medicine for this and that, your plain answer and simple answer will be, sir, we have to there is no in homeopathy we are not prescribing on the name of the disease, and so we are going for totality only. Okay, we will take totality and prescribe accordingly. Okay,
Hello, sir.
anyone? Yes, bolo.
Sir, what did you say about the crisis and lysis? I didn't understand.
Okay, crisis is sudden breakdown. It was a reference to the that typhoid fevers, pattern of the typhoid fever. If you know the pattern of the typhoid fever, all 4 weeks, if suddenly there is a perforation, let me complete it. If there is a perforation, 4th week complication is perforation, and the fever will all of a sudden fall down. This is called crisis. All of a sudden fever is falling down all of a sudden. This is called crisis. Okay, and fever is falling down like this in slab manner, slowly and gradually. This is called lysis. So crisis is not a good thing in natural recovery. Okay, crisis is not a good thing in natural recovery. Lysis is a good thing. The fever is getting slowly and gradually. Graph of the fever is like this. If the graph of the fever getting down is like this, you should know that there is something gondogol inside. Okay, this is not good. That was I was referring about crisis and lysis. Lysis should be there, no crisis. Okay, crisis means some destruction have happened inside. Some destruction have happened inside, and lysis means it is slowly and gradually going. This is lysis, graph of the lysis, and this is the graph of the crisis. Clear?
Sir, then we are doing in homeopathy the lysis manner, treatment.
No, not lysis treatment. We are doing in homeopathy. Lysis is the natural way of recovery. Is it not? The natural way of
Okay.
recovery. Lysis. We are just cutting short it also. We are also cutting it short. Okay. We are not going to suffer the typhoid patient for 4 weeks. We will try to get it recover even before the typhoid is diagnosed in the blood. What Kent have said, that many typhoid fevers have been cured before it is diagnosed, because the Vidal test, when the Vidal test can be diagnosed? Only after second week, no? The first week you have to do a blood culture, although there is a test called typhi dot. IgM in the blood can be diagnosed very first day. Okay, that is called typhi dot for the typhoid fever. Okay, so we are not going to let our patient suffer for 4 whole week and wait for the lysis. Even before that, we will try to recover, get our patient recover even in 2-3 days of typhoid fever. Is it not?
Yes, sir.
Okay. Any question? So I hope you enjoyed the class, and thank you for giving me your attention for 1 hour. We will meet next day on 2 p.m. at 2 p.m. Okay. Thank you. Thank you, everyone.